Welcome to the Gay Therapy LA podcast, the show that empowers gay men to live their fullest, healthiest lives. Whether you're navigating relationships, mental health, intimacy, finances, career, or personal growth, Ken Howard, a licensed clinical social worker in California, certified psychiatric social worker, and AASECT certified sex therapist, is here to guide you with over 30 years of experience, specializing in gay male individuals, couples, and polycules. As the founder of gaytherapyla.com and gaycoachingla.com. And now, today's episode.
Hi, I'm Ken Howard, and welcome to the Gay Therapy LA podcast. Today, I'd like to talk about when non-affirming therapists keep LGBTQ clients for the money, an ethical failure with real consequences. So in my decades of practice, over 30 years, as a gay men's specialist psychotherapist, I've seen a troubling pattern. Therapists who market themselves as welcoming to all while quietly holding and practicing from a non-affirming, often religiously conservative belief system about sexual orientation and gender identity and sexuality. Sometimes the harm is unintentional. Other times it's calculated with a conservative religious social agenda as expressed through a clinical practice. But in either case, the impact on LGBTQ plus clients, especially youth, can be profound and devastating. Let's talk about the financial conflict that no one talks about. There's one uncomfortable truth that I don't see addressed often enough. Some non-affirming therapists knowingly keep LGBTQ plus clients on their caseloads even when they can't truly support their identities, simply because they don't want to lose the income of the client. They know that an affirming referral would be better for the client. They know their own values are incompatible with affirming practice, but they keep the case anyway. And that's not just poor practice, it's an ethical breach of the psychotherapy profession. Let's talk about the ethical standards that they're violating by this. So under the NASW, the National Association of Social Workers, the governing body in the United States of clinical social workers, Code of Ethics, Section 1.15, social workers should, quote, terminate services to clients and refer them to other professionals when it is in the best interest of the client, meaning an LGBTQ identity. Under the American Association of Marriage and Family Therapists Code of Ethics, Section 1.11, says that marriage and family therapists withdraw from practice when their services are no longer required or no longer serve the client's needs and interests. So if a therapist stays in the case for the paycheck while knowing that they can't provide affirming, non-discriminatory care, they're in direct violation of those standards. And other professional associations like in counseling or American Psychological Association or American Psychiatric Association would have similar ideas about ethical practice. This kind of thing is flirting with exploitation, using the therapeutic relationship for personal gain at the client's expense, not only in the financial sense, but also to satisfy that clinician's conservative, usually religious, but conservative anti-gay, non-affirming stance. They see it as a social agenda, but yet it's acted out on an individual level. And you contrast that with what I do, which is a social contribution to the broader community at large and the diversity of society, one client at a time. But when I do it, it's about a social justice affirmative practice, kind of like psychotherapy practices that challenge racism with one client at a time, but they're addressing a bigger issue of racism or sexism or some of the other isms. Because especially in clinical social work, you might be working with one client at a time, but you're also supporting the idea of diversity and dignity and social justice. So clinical social workers might work with one person or a couple or a polycule or even a group therapy, but they also have an eye toward the larger issue of achieving social justice. Whereas the conservative therapists, the anti-gay ones or the non-affirming ones, are trying to push an agenda of social control around a conservative religious idea, especially with the idea of the role of religious moralism being codified into government policy, which we see in the United States now with Project 2025 and dismantling the separation of church and state in all aspects of life, government, medicine, psychotherapy, school education, all of that stuff. So this is part of what I call the say one thing and do another playbook. Here's how the duplicity often looks, such as masking values. The therapist's website says welcoming to all, but their language frames LGBTQ plus identity as struggling with unwanted attractions or gender confusion. All their marketing photos feature heterosexual couples or cisgender individuals. It's a quiet, visual message about who really belongs there. It's a subtle undermining. In session, they frame LGBTQ plus identity as a symptom of trauma or sin or pathology or developmental confusion. Conversations about self-acceptance get rerouted toward learning self-control or embracing the values and the benefits of celibacy or following God's design or obeying the leadership of their parents or supporting their church community or doing what's expected of them as a responsible citizen. All of those things might find their way into the language. And for trans or non-binary folks, they might not use the correct pronouns. The pronouns are avoided entirely or used inconsistently even after the client corrects them. They avoid transparency. They never state their stance directly as being non-affirmative, but they leave clients or parents to assume that they're affirming, so they kind of dodge the issue. They also drag out treatment. They focus on tangential issues or endless identity exploration. Oh, let's just see about that. Maybe you're not really gay. Maybe this is about you being a teenager and just kind of exploring who you are. Let's make some allowance that maybe you're actually straight. And it avoids real progress toward the client's stated goals, all keeping the billing cycle going. Let's talk about how microaggressions creep in. The damage isn't always in these obvious moments. Sometimes it's in the quiet, repeated signals that a client's identity isn't truly accepted. In advertising and promotional materials for these kinds of practices, they might use coded terms like promoting family values or offering biblical guidance or promoting traditional lifestyles that replace any direct mention of LGBTQ+. The stock photos exclusively depict heterosexual couples or cisgender people, like was said a minute ago. Same-sex attraction or gender struggles are used instead of clear affirming terms. So in the session, any mention of an LGBTQ plus identity, any of those, being a lesbian, being a gay man, being a bisexual man or woman or pansexual or non-binary person, or being transmasculine or transfeminine or queer identity or pansexual, is pathologized and reframed as something to resist, something that can be overcome. We can overcome this together. Let me help you overcome this so you'll be okay. So in clinical interventions, the identity exploration is actually a path toward heteronormative conformity, or suggesting that the client behaviorally try less gay interests to help the client fit in. Why don't you try, joining a sports league with other boys? Or they might suggest behaviors or assign the client homework from week to week that takes them away from affirmative or LGBT-related activities, like a gay-straight alliance at their school, to doing something that's more about conformity. treating the distress of what the client's going through in terms of coming out or their gender identity as coming from the identity itself rather than from societal rejection and prejudices and discrimination. They're saying it's your problem, it's not society's problem. They might use family therapy to pressure conformity to religious or cultural norms. Let's just be a family. We can get through this. Let's just set things right, meaning the elimination of anything LGBT related. Recommending accountability partners who reinforce shame rather than affirm authenticity. Saying, you can do this. You hang out with your straight friends and let them help you with this confusion that you're going through. During an intake, or what we call a psychosocial assessment, the first couple or several sessions with a therapist, the sexual orientation or gender identity questions are skipped over or glossed over or framed in a stigmatizing way. They might ask a question, do you struggle with same-sex attraction? Their identity is listed as a problem or a diagnosis in the clinical chart, the documentation that the therapist keeps on session. The religious or moral values history is emphasized unnecessarily, steering the assessment toward heteronormativity. They might ask the client if they've tried dating the opposite sex or changing their gender expression, implying that this is the legitimate intervention. Well, have you tried being straight? Maybe you are straight. Maybe you just need to try it more. Maybe you just need to find the right girl to a boy. Let's talk about the harm this does. This behavior is not just sloppy clinical work or self-serving therapists promoting a religious conservative agenda. It's actually harmful because, among other things, it erodes trust in the psychotherapy profession when clients realize that they've been misled. It makes them embittered to not just that therapist or non-affirming styles of therapy, but it embitters them about therapy in general that might keep them from getting affirming help from affirming therapists down the line. It increases psychological distress, especially for minors who are forming their sense of self. It delays access to competent and affirming care, which is really critical for suicide prevention in youth. They need to have affirming care quickly, or else the arc towards self-harm might be promulgated. It creates a long-term trauma response tied to the therapy itself. For example, I work with a fellow now who's in his early 30s or so, and many of the sessions that we talk about, he just cannot get over the anger and the frustration about being exposed to a conversion therapy therapist when he was younger, forced by his conservative parents to do that. And then also the anti-gay messages that he got from a non-religious cult, not a conservative church, but one of these kind of guru cults that was actually anti-gay. Even things like Scientology are known to be anti-gay, even though they're not exactly Judeo-Christian, but they still have this anti-gay component. And so this fella in early middle age, in his 30s, is having to navigate the world living with a chronic anger about how these clinicians in his past harmed him and delayed him. He said, I gave the best years of my youth to being exposed to providers who wanted to shame me for being gay. And that was my youth. I could have been out enjoying myself. I could have been enjoying my youthful looks. I could have been enjoying my youthful libido. And instead, he was getting this pressure from these non-affirmative providers. So that's a real harm, for example. And he's not the only one who has had experiences like that. So why does this persist so much? I mean, we're making some progress. There are laws that are being passed against conversion therapy. We know that's harmful. It's been studied very carefully. And fortunately, a lot of jurisdictions, a lot of states in America are declaring conversion therapy or reparative therapy as harmful and banning it from providers using it, at least with minors, in some cases with everybody, because it's not legitimate psychotherapy. But in areas where there are very few affirming providers, maybe in rural areas of America or the red states in the American Southeast, for example, non-affirming therapists might dominate the market. So finding an affirmative therapist can be like a needle in a haystack if you're in one of these red state conservative, Protestant conservative religious environments. Some religiously aligned practices coach clinicians to soften non-affirming language to keep clients without losing doctrinal control. And there's minimal oversight because unless someone files a complaint with the state board that oversees psychotherapists in that state, each state has one, it just continues unchecked. How would we know that these non-affirmative and unethical practices are persisting? We wouldn't know unless someone speaks up. And many clients, especially youth clients, don't even know that they can file a complaint with a state board. They might not know that a state board governs therapists when they do. Local churches might refer to non-affirming therapists. And in some cases, there's an access to care issue. There just aren't that many therapists in that community. And this is why I provide affirmative coaching. If a client approaches me from a state where I'm not licensed, then I can't provide psychotherapy legally because you have to be licensed in each state. But what we do then is we take the coaching model, which has some overlap, quite a bit of overlap with therapy, but some very, very important legal and ethical differences and approaches. And we make it clear that we're not treating a mental disorder or having a clinical diagnosis, but it's more about making positive life goals and working toward those goals very behaviorally in relationships or finances or career or sexuality. But it's not the delivery of clinical mental health services. And that's why with online telehealth services, especially in coaching, that's how somebody in a rural area might access an affirming provider like me because they have to go outside their local area in order to have access to a provider who is affirming, either a therapist or a coach. Let's talk about what clients and parents can do. So if you're seeking therapy for yourself or for your child, don't be afraid to ask very direct questions up front of that provider. Ask them, do you affirm and support LGBTQ plus identities without trying to change them? See how they answer. You might ask, do you follow the APA, NASW, or AAMFT guidelines on sexual orientation and gender identity? Do they even know what those are? Have they had any kind of training in sexual orientation and gender identity? A lot of therapists get very, very scant continuing education or very, very scant education in their original master's or doctoral programs in the curriculum about sexuality. This is why I'm an ASEX certified sex therapist, because a lot of therapists are expected to address sexual issues. A lot of couples might go to, let's say, a marriage and family therapist and expect to talk about their sex life when maybe that therapist, likely that therapist did not have a whole lot of sexuality training, because that's not part of graduate school training in a lot of master's level counseling programs or even doctoral level counseling programs. You have to have special training to address sex therapy and address sexual orientation and gender diversity and working with sexual and gender minorities, because unless you had specialized training in it, you're really kind of undertrained or under-equipped to work with these kinds of clients. Although you have plenty of people who think they're qualified, they're actually not. This is why books like my colleague Joe Court in Detroit, who wrote a book called Gay-Affirmative Therapy for the Straight Clinician, and I think there's a second edition with a different title, but he has written books and done trainings for mainstream therapists on sexual orientation and gender identity issues, because Clinicians need that. Even an affirming clinician, a well-meaning affirming clinician that's not especially religiously prejudiced or anything, they have a sincere desire to learn. But without that additional training in human sexuality and sexual and gender minorities, they wouldn't be fully equipped to work with these clients effectively. You might ask a provider, can you describe, use the open-ended question, can you describe your work with other LGBTQ clients? And see what they say. Now, they can't name names and they can't get too specific so that the person's identifiable and say, oh, that sounds like my friend John. Oh, I know him. He lives across the street. Ethically, you can't do much about that if they could guess who it is. That's why when I talk about case examples like I just did, I'm changing some details so that you can't say, oh, well, I know who that is. That's my friend Bob. You can't fool me, because it's a small world. But you can ask to just, in general, describe your work with other LGBTQ clients. And if they're vague or evasive, or they get a little flustered and say, like you put them on the spot or you've caught them off guard, vague or evasive answers are red flags because they don't want to come out and say, I don't deal with this. So non-affirming therapists who keep LGBTQ clients under false pretenses are violating both ethics and trust. And it's not a small matter because the harm is real. And it's preventable when clients are empowered to recognize the signs of that kind of exploitation. So if you or someone you love truly needs affirmative therapy or coaching, not this watered down, coded stuff, then reach out. I've spent over 30 years working exclusively with gay men and other LGBTQ plus clients with a foundation of full affirmation and support. You can reach me at 310-339-5778 in the United States. Outside, I think you put an 01 in front of that. 310-339-5778. Or email me, ken@gaytherapyla.com or ken@gaycoachingla.com. Both of those will reach me. And if I sound a little heated on this, it's because I'm very passionate about affirming the LGBTQ identity, especially with my specialty in gay men, but really everybody in that spectrum. And I am particularly annoyed with conservative therapists who really do more harm than good. And we have lots and lots and lots of examples of that, and a lot of discussion with reparative therapy or conversion therapy. Sometimes it's not even overt conversion therapy. Sometimes it's just a more subtle kind of insidious lack of validation that still can result in harm, even if the person is not that overtly into conversion therapy, especially when it's been made illegal. So it drives conversion therapy or non-affirming therapy underground because they don't want to get in trouble for doing it overtly, so they do it more covertly. And that's where the insidious and harmful aspect can arise. So, thanks. I'll see you next time.